Hello and welcome to Pisgah Health Today. My name is Angela Owen. It's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Chris Watson, who serves as the Program Director for the Community Housing Coalition, also known as CHC of Madison County. Welcome to our program today, Chris.
Thank you, Angela.
Chris has been working in affordable housing and housing rehab since the ripe old age of 2 years old, when his parents took him on a mission rehab trip to the coast of South Carolina. He was involved with his father's mission program in South Carolina. When he started that, he was also a part of the Habitat for Humanity in Columbia, South Carolina, where his father also served. He has experience out in the state of Arizona doing under the Home Repair and Recovery Act, and he's now been at CHC for 7 years. That passion runs deep and long inside of you, Chris. Welcome to our program. Why don't you start by telling our viewers, what is the Community Housing Coalition of Madison County?
Well, the Community Housing Coalition of Madison County was started about 20 years ago in response to an overwhelming need for housing repair in the county. And at the time, there were a number of faith-based mission groups. Faith-based mission groups that were coming to the county and doing home repair, but there wasn't kind of a central clearinghouse in the county. And so community leaders came together and formed the Community Housing Coalition, and we've been focusing on meeting the housing repair needs of low-income families here in the county since very much focused on using volunteer resources and bridging those volunteer resources with federal, state grant dollars, as well as donations and foundation grants to have as much impact around quality, safe, affordable housing here in Madison County. We also advocate for affordable housing policies and work with our local governments to try to find a solution to the growing housing crisis here in Madison County and the region. One of our biggest goals is really to allow our clients to age in place, in homes that are safe, accessible, healthy, and affordable. Most of our clients are elderly or disabled, and all of them are under 80% area median income. Most of them fall in the very low income categories defined by HUD. And we serve about 80 homes per year here in Madison, but we have an active client list of 140 to 160 depending on the time of year. So really only about to serve, able to get to about half the need. And so it's a challenge, but we've grown in both our program offerings and our impact over the past few years, and we're really excited about our latest partnership with Pisgah Health Foundation and allowing those programs to grow.
Tell us a little, how has the grant that you did receive from Pisgah Health Foundation specifically helped you to serve so many of those needs that you've got there in the community?
Well, like I said, we're very volunteer driven, and about half of our annual impact, or about $250,000 worth of impact on housing here in the county, comes from our volunteer programs. And we have a summer mission program which brings about 1,000 to 1,200 volunteers each summer. And that, unfortunately, that program got canceled this summer because of COVID. And what Pisgah Health has allowed us to do is they've provided an investment to strengthen and allow us to grow our local volunteer program, where we coordinate, recruit, and train local volunteers within their communities to assist with housing repairs. And that program's been going for about 4 or 5 years now. And through the Pisgah Health Foundation grant, we were able to make an investment in new tools and equipment for that program, staffing to increase the number of volunteers and the number of folks we can serve on an annual basis, as well as doing a lot of training around increasing the health of homes, reducing toxins, mold, and making sure that not just repairing the home so that it's safe and accessible, but also really addressing the healthy aspects of the house. And then we're also doing some, through the Pisgah Health Foundation, doing some, it seems really simple, but it's always been a hard thing for us to do, and that's get simple safety equipment into people's homes, like smoke detectors, CO detectors, fire extinguishers. Nearly all of our clients are missing some vital piece of safety equipment, and Pisgah Health provided some funding so that every house we go to, we can immediately make that determination if they need a smoke detector or a carbon monoxide detector, and we can go ahead and do that install. And it's a low cost, easy repair that could save someone's life. So really looking at housing and how it is, how the health of the house really determines the health of the occupant, and being able to take these volunteer-based programs and grow them over the next 5 or 10 years, with the investment that Pisgah Health has given us, is something we are really excited about, so that folks aren't having to wait as long to get repairs, and we can perform more repairs and kind of get over that 50% service level and try to get more serving the people that are in need, when their needs arise.
Absolutely. Chris, as you talk, I hear you connecting so many really important pieces. You connect the volunteer community, you connect the faith community, you connect in the federal community from the standpoint of advocacy for affordable housing. You talk about very practical components like smoke detectors, the carbon monoxide detector, things that many of us perhaps are just going to take for granted. And early in the interview here, you mentioned age in place. I would just love to know, what do you see? Like, do you have a particular story from someone who, because of the work you've done and you've helped their home be a safe place for them to stay, what kind of impact does that make on these residents, many of them, as you spoke of, elderly, that they're able to stay in their own home throughout the end of their latter years?
Well, we see that is such a important piece of having a strong community. Madison County is almost entirely rural. Many of our clients who are seniors have lived on their land their entire lives. Often their land is generationally owned, and there's a long history there. And they're really serve as the threads that hold those communities together. And so, we have a client that we worked with, and we're seeing this so much more, where these grandparents who are becoming primary caregivers for their grandchildren because of the opioid epidemic. And so their home was becoming inaccessible and dangerous for them to live in. And when they finally reached out for help, we were able to go in and make that home safe and accessible for them to live out their lives, with things like a ramp and accessible bathroom modifications, and then just addressing some of the general health and safety of the home. But then that allowed them to actually bring their grandchildren to their home and provide a safe place for their grandchildren, when otherwise both the elderly couple would have been displaced potentially outside of their community, and their grandchildren would have had been put in foster care outside of the community. So it's become this challenge, but also this opportunity to really, keep as many people in our community as possible, whether it's our seniors or our children. And it can be a very sad and heavy heavy part of the work, but it's also really rewarding and feels really good when we can. And the focus of that work is really, using volunteer programs, using home repair programs to reweave that frayed fabric of our society, and allowing people to age in place and continue to be a resource and for their communities, their stories, their land, their skills, and their insights as elders are just so important to maintaining the culture of our community. And the other, I don't even know what the alternative is if they can't live in their homes. There's, as we know, the housing crisis, there's nowhere for them to go. So the only, their healthy outcomes, their quality of life is so dependent on them living there. They will live in a house that is going to fall down on their heads rather than move somewhere else, because that is where they are from. And it feels so good to be able to keep people, in their communities and in their homes, so that they can continue to be such vital parts of the community.
It's a great story. So many more things than just the physical structure that are happening as you make those repairs. That's fantastic, Chris. What else, before we wrap things up today, would you like our viewers to know about CHC and how they might come alongside and support you and get involved in the great work you're doing there in Madison County?
Well, we are always looking for volunteers. We have a number of ways volunteers can get involved, whether it's through our home repair program. If you come to one of our Neighbors Helping Neighbors work days, we provide all the training, the supervision, the tools, the materials. And we have been able to modify our program to be safe and during the pandemic. And, we also have opportunities on our board. We have a retail thrift store here in Marshall called Reclaim Madison that is a great place to volunteer. And then if you're interested in learning more about us or getting involved, you can reach out to me. You can reach out to our office here in Marshall. Another interesting thing that I just wanted to share was that's been really exciting for the Community Housing Coalition over the past year. In June of last year, our executive director resigned, and we were looking at our leadership structure, and decided as a team that we were going to implement a shared leadership model. So rather than hiring in a new executive director, we developed, and we're still kind of in the process of implementing all of this, but we've developed a shared leadership model where we have a series of team leaders who help lead the agency, and everyone has buy-in and everyone feels accountable. And it's just been really empowering to our entire staff, from our hourly folks who are working down at our store, to our field workers and our office support team, to really be fully engaged and fully a part of all the processes here and the decision making. And we're just really excited about that. And if there's anyone out there interested in learning more about shared leadership and how that can be implemented in a nonprofit or in a small business, we'd be happy to talk more about that.
It's fantastic. You're making a difference right there with the leaders within your own organization. So well done, Chris. And on behalf of the board of directors at Pisgah Health Foundation, let me say thank you to you and the rest of those leaders around you who are making such a difference through the CHC at Madison County and really helping people through those home repairs and such. So thank you so much. And thank you for being a part of the program today.
Thank you, Angela. And thank you so much to Pisgah Health Foundation for all their support. We're really excited about our future.
Fantastic. We also want to thank Wildflower Media for their creative and technical support in bringing this program to you, as well as we want to thank the board of directors and the staff at Pisgah Health Foundation and the Physicians Roundtable, all who are working so diligently on behalf of the residents of Western North Carolina. Until we see you on the next Pisgah Health Today, stay well, be well.